now going to go over what I like to call the semi-open pigtail technique. Your setup, draping of the patient, cleaning the patient, everything else is going to be the same as your usual pigtail, but the technique is a little bit different. You're going to open up your kit, and you're also going to bring a suture kit so you have access to a small mosquito clamp. The things that you still need are the needle with the syringe, the wire, the pigtail itself, scalpel, and the setup, the stopcock with the flutter valve setup for the chest tube. You're going to numb up the skin as usual, and you're actually going to cut open the skin with a knife like you would for a usual chest tube. What you want to do is you want to go in over the rib and you want to cut, but you're only cutting small, about the width of your pinky finger. You cut all the way down until you feel the rib. Once you feel the rib, then you're going to use your mosquito clamp and you're going to pop in over the rib just like you would if you were doing an open chest tube. So you hold your finger over the mosquito clamp, you go in over the rib, and you pop through. Once you're in, you open up your mosquitoes and spread. Now the differences come in. Once your mosquito is in the chest, you're going to take your needle with your syringe and you're going to thread it in between the two halves of the mosquito clamp over the rib and into the chest. Essentially, you're going into the hole you already created with the needle. Once your needle is in, then you're going to thread the wire over the needle into the hole in the chest. And then, as usual, you're going to thread your chest tube over the wire and pull the wire out. The reason that this is nice is because it gives you the tactile feedback of actually going into the chest, as opposed to the Seldinger technique where you're just going in with the needle and then dilating, and sometimes you're not sure exactly where you are. The reason you use the wire to place the chest tube is because, as you can see, this is a very flexible chest tube and sometimes it can curl under the skin. So you actually do want to use the wire to make sure that you're in the chest. Once you're in there, really important is when you attach the stopcock to the chest tube, that this white cap you take off and replace with a red cap for the IVs, because this white cap has a hole in it, and if you leave this one on, you're going to get a continuous air leak and you're going to make your pneumothorax worse. Then you tape all the usual connections and tie the chest tube in just like you would a normal pigtail. And that's it.